today's session, we will focus on elder abuse and answer the following questions. What are the most commonly used definitions of elder abuse and violence against older women? What forms of violence exist? And what signs of violence could be identified? Violence against older persons is a global issue that is usually overlooked. Data on the prevalence of violence against the elderly is insufficient and underreported, as the issue is commonly perceived as a taboo. Existing prevalence studies on violence against older persons range globally between 1% and 35%. According to the World Health Organization, around 1 in 6 people who are 60 years and older have experienced some form of abuse in community settings during the past year. However, WHO assumes that these figures may reflect only a small number, and some experts believe elder abuse is underreported by as much as 80%. In 1995, Action on Elder Abuse proposed a definition of elder abuse, which became the most commonly used one. It was developed further in 2002 and is used as an umbrella term for the wide range of harm inflicted to older people. According to it, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust. It causes harm or distress to an older person or violates their human and civil rights. The U.S. Department of Justice and the Department of Health and Human Services provide a broader view of violence against older persons. According to them, elder abuse includes physical abuse, sexual abuse, psychological abuse, as well as neglect and abandonment. It also includes financial exploitation of an older person by another person or entity. It can occur in any setting, for example, home, community, or facility, either in a relationship where there is an expectation of trust and/or when an older person is targeted based on age or disability. Conversely, the World Health Organization defines violence against older women as any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering to older women. It includes threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in public or private life. This can also include financial abuse, exploitation, or deprivation of resources, neglect, and abandonment. The circumstances of abuse of older men and women are often quite similar. For this reason, in this course, we will generally use the terms elder abuse or abuse of older persons. However, most types of abuse also have clear gender-based elements because sexism and discrimination can put women at higher risk than men. In this course, we will highlight these gender-based elements whenever relevant. Our online course highlights the gendered nature of elder abuse. Violence against older women has the same roots as violence against women in general. It is based on gender inequality and discriminatory gender norms. Age does not define abusive behavior as elder abuse. For example, if a woman is a victim of intimate partner violence, should she be considered a victim of elder abuse instead just because she is over 50 years old? Older women may have experienced abuse at the hands of their partners throughout their lifetime. Both younger and older victims of violence share similar characteristics, such as fear of revenge coming from the abuser, fear of stigmatization, desire to not leave the home or to protect the abuser, and emotional distress and difficulties in reporting the abuse. However, there are profound differences in the types of interventions that are appropriate for older persons as well as services available to them. For instance, women's shelters are often designed and their staff is not specifically trained to meet the needs of older victims. Even though most research on elder abuse focuses on people who are over 65 years old, the concept of violence against older persons can be applied to victims aged 50 years and older. For several reasons, we believe it is essential to consider younger, quote-unquote, older persons as well. The number of victims aged 50 to 65 who access domestic violence services is, in general, rather low. Moreover, this age group rarely uses social and healthcare services intended for the elderly. As they fall into the gap between younger victims of abuse and older people over 65 years old, it creates a lack of knowledge about victims of this age group. we intend to cover this gap and extend the framework of the concept of violence against older persons. Violence against older people can be divided into the following categories: physical abuse, sexual abuse or abusive sexual contact, sexual harassment and stalking, emotional or psychological abuse, neglect of care and assistance, financial abuse or exploitation, or institutional abuse. Now we are going to discuss each type of abuse in detail and give descriptions of certain signs which can indicate whether an older person is experiencing this particular type of abuse. Physical abuse refers to the use of physical force against an older person, which can cause bodily harm, permanent impairment, or physical pain. This may include striking an older person with a hand or an object, scratching, biting, slapping, choking or strangling, pushing, kicking, burning, throwing things at a person, using weapons or other objects to inflict pain, force feeding or denying food, physical restraining, and or forced inappropriate use of medication or intoxication. According to the 2014 Fundamental Rights Agency survey, which was the first of its kind on violence against women across the 28 EU member states, 2% of the interviewed women aged 60 to 74 years had experienced physical violence by a partner in the 12 months before the interview was conducted. Certain signs can indicate that an older person might be experiencing physical violence. For example, injuries in different stages of healing, bruises, wounds, abrasions, contusions, broken bones, or dislocation of joints. Decreased hearing, sight, or new dental problems, weight or hair loss, poor hygiene are just some of the consequences of physical abuse. Oversedation, reduced physical or mental activity, grogginess, or confusion may be the result of under or over medication. Make sure to pay attention to the older person's behavior, especially if they seem to be cringing, acting fearful, or demonstrate unexplained anger when they are around the carer or relative. The behavior of the person's carer or relative is also essential. If the carer is overly protective or controlling, tells conflicting stories, and does not want to leave the older person alone, it may be a sign of abusive behavior from their side. The next type of violence is sexual abuse or abusive sexual contact. It is any kind of non-consensual sexual interaction, physical or verbal, with an older person. It is believed to be the least reported type of violence against older persons. According to the Fundamental Rights Agency survey, only 1% of women aged 60 to 74 had reported experiencing this type of abuse in the 12 months before the interview. However, some victims of sexual violence may have experienced it for a long time as domestic violence and were afraid to come out about it. There are many physical signs that can help to identify the victim of sexual abuse, which are relevant for the elderly as well. These include unexplained bruising, internal injuries, human bite marks, scratches, bruises, especially if they are on the face, neck, chest, and genitals, choke marks on the throat, mouth or genitals bleeding, unexplained venereal disease, urinary tract infections, anxiety, depression or withdrawal, or fear of being touched. Sexual violence can have a devastating impact on older women, causing long-term suffering such as incontinence and pain when urinating. Other consequences include loss of weight, fear of leaving the house, and loss of enjoyment from social activities. Out of all traumatic experiences, sexual assault in adulthood is believed to be the most stressful one, and it takes time to recover from the trauma. Any unusual shifts in the older person's behavior or their caregiver or relative are also essential to pay attention to, as they could also be signs of possible violence. Sexual harassment and stalking are believed to be experienced primarily by younger women. However, they are almost as universal among all age groups. Sexual harassment is defined as unwelcome sexual advances, requests for sexual favors, and other verbal or physical conduct of a sexual nature. According to the Fundamental Rights Agency survey, on average, 38% of women aged 60 to 74 years had experienced sexual harassment since the age of 15, and 5% experienced it in the 12 months prior to the interviews. Stalking behavior is related to harassment and intimidation and is unwanted or obsessive attention towards the person. It may include following and monitoring a victim, sending unwanted gifts, letters, messages, or texts, damaging a house or car or other property of a victim, or threatening a victim or their family, friends, or pets. Women might face this kind of behavior after they have left their abuser and try to start an independent life. The next type of abuse that we distinguish is believed to be the most common one. It is psychological or emotional violence. It is systematic, non-physical actions which are intended to inflict mental pain, anguish, and suffering on an older person. Examples of this behavior includes humiliation, for example, insults, scolding, verbal intimidation, and shouting; threatening the older person, for example, to threaten them with physical punishment or delaying provision of food; isolating them, for example, not allowing them to see family members or friends, or controlling them in other ways, such as prohibiting or limiting access to transportation, telephone, money, or other resources. As psychological violence does not leave any visible marks, it is hard to prove or identify. However, paying attention to the older person's behavior, especially around the potential abuser, can be very helpful. Signs of psychological violence include feelings of helplessness, shame, and powerlessness, depression, withdrawal, or apathy, loss of interest in self or environment, passivity, reluctance to make decisions, lack of eye contact with other people, unusual nervousness, anger, or paranoid behavior, and/or displays of signs of trauma, for example, rocking back and forth. Similar to the cases of other types of abuse, it is crucial to pay attention to the behavior of the potential perpetrator. If an older person's caregiver or relative tries to isolate the elderly person and seems to be aggressive or overly controlling, it might hint at an abusive relationship. Another classified type of abuse is neglect of care and assistance. Neglect can be defined as a failure by responsible persons to satisfy essential basic needs of an older person, such as medical attention or necessary medication, food, hydration, hygiene, and other basic daily activities, safety, clothing, etc., which results in severe health and safety risks for the older person. Neglect could be unintentional, when a carer does not have the skills and/or knowledge that they need, or intentional, when actions to harm the older person are done on purpose. This is an important distinction to consider. According to the prevalent study of abuse and violence against older women, 5.4% of older women reported that they had experienced neglect in the 12 months before the interview. Neglect can take different forms, such as the inadequate provision of food and drink, or isolation, which results in lack of mental, physical, and social contacts. Please keep in mind that the behavior of a caregiver can change once somebody else is in the room. Furthermore, certain signs within the elderly person can help to identify this type of abusive behavior as well. They include pain, discomfort, or multiple large bed sores, unexpected weight loss, malnutrition, dehydration, or constipation, poor hygiene or unkept appearance, such as the older person's clothes are dirty or they smell strongly of urine, the person is left alone for long periods of time unattended, or they suffer from hypothermia or overheating. The next type of abuse is financial abuse or exploitation. It is defined as illegal or improper exploitation or use of funds or other resources of the older person. For example, controlling the use of money and property that belongs to the older person, theft, or use of coercion or fraud to obtain an older person's money or possessions. According to the FRA survey, 12% of women aged 60 to 74 years had experienced economic violence by a partner since the age of 15. Signs of financial abuse may include numerous unpaid bills or overdue rent that an older person should be able to afford, a recently signed will or changes in a will when an older person is incapable of drafting or signing it, loans or mortgages obtained by an older person, or missing furniture, jewelry, credit cards, or other items. Financial violence against older people can also be accompanied by emotional abuse, for example, threats or intimidation. Therefore, financial exploitation can result in causing fear, lack of trust, and anxiety in an older person's life. The last type of abuse that we are going to review today is institutional abuse. There is no standard definition of this type of abuse. However, it has become common to distinguish individual acts of violence in institutions and actual institutional or institutionalized abuse. The term institution covers a wide range of health and social care settings, as well as any setting where service users interact with professionals outside of their home. This includes hospitals, nursing care homes, daycare, respite care, and care provided by the voluntary sector and hospice care. Institutional abuse can take all of the forms of abuse that I've described previously, such as physical violence, emotional abuse, sexual violence, financial exploitation, or neglect. The difference is that it takes place on the institutional level in the whole organization. For example, institutional abuse can take a form of neglect when there are poor standards of care. In other cases, it can take a form of psychological abuse when the wishes of the residents are ignored and older persons are isolated against their will. Institutional abuse also refers to restraints, including situations where an older person is forced to remain in their bed or chair. Sometimes it is done with the help of mechanical restraints, such as wrist or ankle restraints made of leather or plastic, or by using a chemical restraint, such as various types of drugs. Inappropriate use of restraints within care settings violates a person's rights and dignity. Restraints should only be used in rare and exceptional circumstances for the safety of the older person. Different types of abuse can be combined and take place together at the same time. Some of the signs of abuse that I've discussed today can point to various forms of violence. However, there are general red flags that health and social care professionals can look for when meeting older persons. They include implausible or vague explanations or inconsistent stories, unusual delay in seeking care, unexplained injuries in the past or present, and/or sudden changes in behavior. So today we have introduced the terms and concepts of elder abuse and had a look at the typology of violence against older persons. Each type has its characteristics and signs that could be used to identify it. Next week, we will continue with this topic and introduce risk and protective factors of elder abuse, as well as general consequences of violence. Please make sure to do the weekly assignments before proceeding with the course's material. Thank you for your attention and see you next week.